This conference will now be recorded.
To discuss issues informally with staff and invited guests. The board encourages members of the public to attend work sessions and listen to the discussion, but there is generally no opportunity for public comment. Members of the public wishing to address the board are welcome to do so during the board's regularly scheduled meetings. And we'll move right on into the agenda. So our first thing is a public health update. Margot Lalich, our public health director, I'll turn it over to you.
Good evening, commissioners. Hopefully it's scratchy, Commissioner Quayla, this time.
It's still scratchy.
It's still scratchy, so sorry. I will keep working with IT on that. Anyway, so the updates, I'll just run through them quickly. I think first and foremost is we've lost 3 more members of the community to COVID. 2 were a husband and wife couple. 1 died at home, 1 died in the hospital, and then another member of our community as well. So just want to be very mindful of that. We continue on the other side of it is to increase vaccinations. Part of it is the mandate in both education and healthcare. There are those who are adamant about not getting vaccinated, and there are those who are choosing to get vaccinated willingly and just want to move forward, get back to work, and have a good school year, or just simply not be distracted by the debates anymore. I think I shared with you that I had a very long conversation with someone within a school district last week. It was a very, very thoughtful conversation, and one I will remember long after this pandemic has passed. And I received a phone call actually from that individual this evening on the cusp of getting vaccinated. And it takes a tremendous amount of courage for individuals who are potentially stigmatized now in their communities, who have really done their homework, tried to do their due diligence, balancing maybe ideologies within communities, families, yet the commitment to their work and their desire to do the right thing. And it's so unfortunate that something like this, particularly in the history of public health, has come to this place. But I think it just requires continued patience. And again, that individual just needed reassurance, had more questions, and they were in fact getting vaccinated because their work is very important to them. And we had a conversation about how to navigate those difficult conversations in a way that's not alienating, and recognizing that we all have liberty and individual choices, and we also have the ability to change our mind. And that's one of, I think, the something that we're very fortunate to appreciate and enjoy. Generally speaking, kids are back in school, so I wasn't able to be on the superintendent's meeting today, but as I've said before, so much preparation and I think passion, enthusiasm, as well as responsible concern has gone back into preparing for the children to return. We're supporting the school districts. As I said, we have a liaison to the schools as well. They're dedicated in that regard. We've had vaccination clinics in a number of the school districts as well. OHA is now releasing advisories, periodic advisories that will go to the schools in terms of resource recommendations of perhaps how to, navigate sports or get-togethers or meals. So they're not mandates, but I think that they are useful suggestions. And I went down a rabbit hole of a lot of different links yesterday when the first advisory came out, and a lot of really good resources. So we'll figure out how to share those out in the community without being duplicative, and the comms team, of course, are working on that in a very thoughtful manner. Testing, we went live yesterday at Camp Rylea with our testing operation. Thankful to CMH and the National Guard. We have 2 National Guard staff at Camp Rylea to welcome those who are showing up for their appointment. It's a very smooth operation, and of course there's always some kinks to work out when you stand up anything new, but generally speaking it's going very well. I also stopped by the PIC yesterday, and all of our phones were staffed with dedicated volunteers. We continue to get new volunteers signing up to support the pandemic response. And again, making sure that those who are answering the phones have the most updated information. And again, there's this, desire and increase in demand to get tested, and also obviously to get vaccinated. I was just looking at the data, and I would think that at this point in time, 72% of our population 18 and older has their first dose. 65% have completed the series that are 18 and older in our county. And there's about 2,500 more individuals that need to be vaccinated who are 18 and older to reach 80% to our county. So we're moving towards that. And again, a lot of questions around boosters. And so I'll jump into that quickly. It's going to roll out very differently than obviously phase 1 of the vaccination campaign. Few different considerations the OHA is working on based upon approvals that are coming forth likely at some point for Pfizer, as well as OHA is putting together regional strategy teams to support the local public health authorities to develop plans and strategies, because it will be different vaccinations, different populations when they're eligible. And so it's definitely there's going to be a little bit more logistics involved in it. But it looks like for the younger population, November 2021, we'll be able to start vaccinating 5 to 11-year-olds. I'm not sure if that's emergency use authorization. I'm going to assume at this moment that it is. I'm sure there'll be more information this Friday. And then January 2022 for the 6 months to 4 years. So that's going to take significant planning. And again, we have many more entities that have vaccines in the community. So the most important is to make sure that there's an adequate inventory, as well as proper education and guidance. And again, like other vaccinations, if these, especially the younger population, can be vaccinated in their medical homes with their primary care providers, that is the best place. But also for this 5 to 11-year-old population, schools are a very familiar place for them. The staff know them. They're a very supportive environment. So if we have the opportunity to partner with our districts when we focus on this population, we'll do so. I do know from our Friday call that some counties they're just like, the state, we really need your help. It's they're just hitting a wall in terms of trying to balance the routine operations and demands of public health, in addition to what may look like a fairly complex rollout of booster doses. And just, I shared this morning in our VTF meeting, we're so focused on COVID, and I keep saying, the rest of public health is still happening 24/7. Is we received a health alert. We have now evacuees from Afghanistan, right? Refugees, and they're coming with a different immunization history. So now we're monitoring for both measles and polio, right? Something that we know we have measles in this country. There's been a resurgence of it, but manageable, and we get people vaccinated, and it's fairly easy to manage any measles exposures. But we don't really think about polio, right? We vaccinate our kids, but it's just not something we see. But here it is, still very real in many parts of the world, and now maybe present in our country as well, as we resettle individuals. So again, it's an alert that's gone out to the whole medical community. Let's see. Cases, I mentioned, I'm kind of circling back to testing just real quickly, that we have that surge in testing demand, individuals wanting to get tested in place of vaccination. Of course, this was prior to the most recent mandates that have come down, but it's pretty consistent in terms of our testing. And we had a meeting this morning, and with Providence as well. There's anywhere between 30, 65 tests a day. Individuals coming through, but they're paying attention to the public messaging that we're putting out there. And again, those who are positive, we notify that same day. There's always a educational element, and we do capture information when they come to get tested, actually make their appointment about whether or not they're vaccinated or unvaccinated. I think that's it for me on the COVID side. If you have any questions, happy to answer if I can.
Any questions for our public health director? Commissioner Banks, and then Commissioner Thompson.
So are we continuing to do those evening, public health meetings or open forums for community members? And if we're not, how successful were they bringing like the conversation into more of a homey type feel? Did we have success with that? Because I feel like with our hesitant population, if we can come to them a little bit more versus, I don't know. I was just trying to think of the different demographics that we have that are continuing to be hesitant. How can we have conversations with them? Because I loved how you spoke about that one-on-one conversation. I feel like that is what's needed, but on a bigger, I guess, reach more people platform.
Yeah, so thanks for asking that question. We did have multiple Q&As. We had 3 or 4 in which we had a whole panel. You were part of that as well as Commissioner Cuela. And while there was a demand for it, it actually was I would say, poorly tended, to be honest with you. There were some good questions. We also had a Q&A out in the Jewel School District. As well as for Napa and other school districts were invited to participate in that. And we also partnered with both CCA and Consuelo Hispano, and we offered those in Spanish as well. So, a few weeks ago, maybe, I don't know, 3 weeks ago, I reached out to our same colleagues and thought maybe this might be a good time to do it. It was summertime, difficult to get everyone in sync with their schedules. Previously, we were still doing the vaccination events, so it was easier to schedule. I'll be honest that I don't think that's the best way to reach populations. I think that, that greater intimacy, greater connection, if there was, and I've shared this with the superintendents, but if there's an event going on at the school and they would like someone to come out, so there's that real human connection, not just this virtual. I'm more than happy and willing to have those conversations and manage the dialogue in such a way that it doesn't become contentious. But again, I just think we need to be very thoughtful about that so that we use our time and resources wisely, right?
I did like the words you used, more intimate and more warm conversation, because I think at this point that might be the step that we need to further pursue with the population that we're discussing. So I appreciate those words. Thanks.
Mm-hmm.
Commissioner Thompson.
Thank you, Mr. Chair. I really appreciate the sense of warmth and compassion and empathy, because really we're all community and we want to look out for each other. When I do risk analysis, whether it's COVID or anything, I want to consider longer term consequences. And what I'm seeing both in family member and in a new friend is what they call the COVID fog. For somebody who gets it and lives, but can't think clearly the way they used to for extended periods. And for me, that's a consideration I would like people to really think about. And I don't know, what do you think about including that kind? Do you have those kinds of data besides anecdotal, or how do we include longer term consequences?
Yeah, the long COVID. Yes, there is data, and I don't know specifically for Clatsop County, and I think probably the numbers are possibly so small that they wouldn't be reporting it yet. You know, it's interesting you bring this up, because one of the other concerns that I have is, and I think Commissioner Quayla, this may resonate with conversations they have at the hospital, is the awareness that the hospitals are operating under different protocols right now. It's not just delaying elective surgeries, right? But it's different protocols in terms of level of care and intensity of care and duration of care, right? When a system is overwhelmed, you have to start prioritizing. And so there's this sense of choice about whether or not I want to be vaccinated, and whatever my beliefs are about the government or, you know, treatment modalities or any of it. But once someone is sick, and particularly if they can't breathe, they want care, and they want very good care, and that they receive very good care, no matter who they are, what their belief systems are, where they come from. But the care that's being provided right now is not necessarily the extensive care that somebody may be receiving in other situations, because the system is overwhelmed, right, with the surge. And so it isn't business as usual in all, you know, once someone crosses that threshold into receiving tertiary care. And so I think that I think the conversation and that communication needs to be more inclusive of these other considerations as well. So I appreciate you bringing this up. Thank you.
I think to Director Lalich's point, and you just need to talk to a nurse or a provider here at Columbia Memorial Hospital and get a feedback from them of what they've had to deal with, not just over the last 18 months, but especially over this last month and a half. This has been very tense. A wing of the hospital had to be converted over for a COVID unit. That used to be a same-day services wing. Now it's full of COVID patients. We've had as many as 11 in the hospital here. There are, I think, 50 that have gone through, have been hospitalized here, and over the last month, 85% of those are unvaccinated. And those are the ones that are needing to stay longer. They're the ones that end up on ventilators. They're the ones that end up being transported to Portland for higher levels of care. It's so clear the difference between being unvaccinated and dealing with COVID and being vaccinated and dealing with COVID. The vaccinated individuals, their length of stay is 2 to 5 days on average. If you're vaccinated, it's much longer, and it puts a lot of stress on all of our caregivers here in the hospital, and it's put a whole lot of stress across the nation. And you see in Idaho and Hawaii where the governors are signing orders for hospitals to go ahead and ration care because they want to provide liability protections for some of these institutions, hospital organizations, because they can't provide that level of service to everybody because the system is so stressed. So it's just one thing. I mean, it's so important, I think, for all of us to be advocates to get vaccinated. I'm just a strong believer in it, and to see what has happened here at the hospital, I think a lot of you would be too. I think most of you would agree that this is the way to get out of this, is to get as many people vaccinated as possible. Any other questions or comments? Commissioner Banks?
Do we have any firmer information regarding the new variant that is approaching? I assume our community, we're currently dealing with the Delta variant, but with the new MU variant, obviously it's rumor, but the rumor is that it is able to surpass vaccinations. And do you have any actual concrete information on it versus what we're just seeing in the news and the media?
Right. So OHA is monitoring it. It's a variant of concern. But in terms of, and my knowledge is the same, that that it's not, the current vaccines that we're receiving are not protective against this variant. There aren't a whole lot of questions popping up at our twice a week meetings with clinical leadership at the state and the epidemiologists, because everyone's just so focused on the present moment and just trying to protect lives until we get to the next, right? So planning ahead, not wanting to be reactive, and yet really having to devote our resources into the present moment. So I would expect by our next meeting, I'll have more of an update for you on what's happening in Oregon.
And please correct me if I'm wrong. Both variants came from international locations, correct?
That's my understanding.
Okay. So will we are we basically just, I guess are we just in this boat for the long term until our international brothers and sisters can catch up on their vaccination rates?
Right. So that's a kind of a loaded question, and it's a very complex.
I'm so sorry.
Right, and not one that I can certainly answer in this meeting. What I will say is, yes, we're in this for the long haul. We've got another year of this, at least, I'm sure. And again, as much as we're planning for this, I'm thinking, as I've mentioned, flu season, right? Okay, so at our testing site, maybe we'll be testing for influenza because the symptoms of Delta are similar to flu, but we want to make sure that we have a differential, at least testing diagnosis, if you will, right? That's important for how it gets managed. So what we do know, and I think I circle back to the relocation of those coming from Afghanistan, right? A very traumatized population, is that communicable diseases circulate throughout the world, right? We don't see polio here, but polio is endemic in other parts of the world. But we have mechanisms to protect the general population to intervene, and I think that is the extraordinary effort of public health, right? Of learning about these diseases over, well over a century. And so it's kind of how I look at COVID. It's here to stay. It's not going to go away. It's endemic in populations. It will probably keep mutating until it stops mutating. We will have natural immunities. We'll have vaccinations, just like we do for other communicable diseases. And in the meantime, we're learning how to more and more effectively manage it, right? We know the risk factors. We know a lot at this point, and we're so much further ahead than we were a year ago or even 2 years ago, right? It's hard to remember a year and a half or 2 years ago, but so that's my response to that question.
Any other questions?
If there are no other questions, Commissioner, I just I want to say, and I do want to say this in the more public forum, that I just want public health, myself, are very, very appreciative of the support of all of you, but also the IT department, buildings and grounds, emergency management, because they are responsive to our needs on a daily basis to make sure that communication is working well, so that the public can continue to call in and get information. To date, that has worked smoothly, making sure that we have the connectivity that we need when there are gaps in that. Emergency management out in Caprilia is working to make sure that our current operations are working well, and in preparation for what we may need going forward. And there's a lot going on in the county and a lot of needs in the county, building a new jail, so many other projects. But that phone call, that help desk ticket, they're very, very responsive, and I just want that to be publicly recognized.
And thank you, Director Lawlich. I'm glad you mentioned that. It is a team effort, and we do have a tremendous team around us. And we certainly appreciate all that you're doing, and let us know how we can help you. We'll move on to item number 2, which is broadband funding. And this is for the Jewel LC area. We have 15 minutes. It's on page 3.
Chair Quayla, if I may just introduce really quickly, if that is okay.
Yes.
Members of the board, as you will recall, really this was pre-pandemic, but then it really took a focal point during the pandemic was a conversation about the broadband infrastructure or the lack thereof in certain parts of the county. There was some initial meetings early on where I think Superintendent Phillips, as well as Commissioner Thompson, and at the time Representative Mitchell and others were convening groups to talk about a path forward. So the county did hire a consultant, Richard Henry, who helped us just kind of get some alignment, hold some stakeholder groups, just collect information and data. Jim Gardner from our IT staff was right there leading the way also. So there's been a lot of progress made, but the most important part of all this progress and the reason why we're here talking is that Superintendent Phillips has taken a leadership role on this project, which honestly has made the difference about moving something forward. So I want to thank him for his leadership and all of his efforts, and I'll pass the baton for his presentation.
Hey, Steve. I think you're still muted there. There you go.
There you
go. Can you hear me?
We can hear you now.
I'm sorry. I right when Don was speaking, my internet dropped.
Oh no.
Yeah.
Not always
See,
the
we
case.
have internet problems in Jewel.
Sounds like you got internet problems. Yeah. Sounds like we should be talking about this.
Yeah. So first of all, thank you very much for allowing me to take some of your time, Commissioner Quayla, and the rest of you. I really appreciate it. So I'm gonna jump right in and start. First of all, just a quick video. It's about 3.5 minutes, and it will introduce the gentleman that we hope to hire to do this work. And so I will play this, and then I'll give a quick presentation.
Steve, we can't hear that very well.
That's 100%. I don't know how to make it better.
High school, but this is a 150-foot tower that
There you go.
county sponsored, so we can provide for kids. Last year, that range from 60 feet to 100 feet. During this COVID pandemic, over the last year, we've been able to put these towers in, which has been able to provide teachers to access the internet, students access. Online instead of having to go into the facilities. We've also been able to help people work from home. Since their kids are always been in their house, it's been easier for them to be able to do that. For me, it's districts, the Sept Valley, Tillamook, and the County school districts, and said, hey, this is what I do. We offer internet. How can I help you? The help of the county and the state and the Sept Valley School District for the South County, we've been able to put that together pretty well. We're still working with the economy to be able to develop new tower sites up north to be able to provide the same type of services. The towers are just for students or teachers. Anybody can get the service. Anybody can see what I do myself. That would be okay. Certainly say no. This is projects with civic programs.
Yeah, unfortunately, Steve, we couldn't hear a lot of that. Can you make this available for all of us to review? Because it'll be very helpful, I think, for us to maybe on our own review it.
Yes, I can. I believe Jim and Dawn and Teresa might have it, but I can send it again. Sure.
Okay, thank you.
Yeah, I apologize for that. I don't know what happened.
No worries.
So bottom line is we think we can do what Tillamook has done. We're in the same situation. Tillamook County had sparsely populated areas, not very great internet. Our main provider out here in Jewel is CenturyLink, and they won't take any more customers. And so it's pretty maxed out, and frankly, the service they do provide is hit and miss because they're so maxed out. And so it's tough. And in the spring of 2020, we did survey our families, and only 40% had reliable internet. And some of that they consider reliable is frankly just because they're so desperate they think it's reliable, and that is internet through their phone. It's tough out here. When we go to distance learning, if we have a COVID shutdown, it's old school packets. It's not online, and that's tough for our kids. It's tough for our teachers to know that they're kind of missing out on a better way. So things that we can take advantage of that maybe Tillamook County didn't is they just did this down there. And the same guy that did it there, he wants to do it for us and his company. Also, a big difference is they start with 100 meg and we start with 1 gig. So we start here at Jewel School, if that's our backbone, that's where we start with our fiber. We start with 10 times the bandwidth. So when we push it out through these towers, our quote customers will get a better product than they got in Tillamook, and Tillamook is extremely happy with theirs. The school district's very happy, the community's happy. It's worked out really well. Also, Eric and his team have already done some geo mapping on where to place the towers, and so we can hit the most people and get the biggest reach because of the towers are going to be on high spots. This is a map that actually Clatsop County, you all helped us with. If you look about in the center of the map, you'll see the little schoolhouse. That's where we are, our school. And if you go south, you hit Vine Maple and Elsie. That number 50 and 27, those are how many kids that go to Jewel School live in those areas. So that's phase 1, is going down there and getting those kids. If you go north, kind of northeast, where you see the 7 and then the 4 and then the 2 and then up is the 9, that's Fishhawk, Fishhawk Lake. And so phase one of the towers, this is phase one at the very top of the page, those two blue dots, that's Jewel School where we would start. And then we would run kind of down south of 103, and the three towers at the bottom there, NVCC is Nehalem Valley Christian Church, and we would put a tower there, and then that tower would beam over to sub tower 1 and sub tower 2, and that by far is our biggest community. It's on Vine, Maple, and Maple Roads. Phase 2 would go from the school north, and that would hit Fishhawk, the Fishhawk Lake community. To be honest, we don't have a ton of students there, but it's a big community, and they need internet as well. And then our last phase would be, the purple would be phase 1. We would tie on to phase 1 and keep pushing south to Highway 26. That would be the Elderberry area and Baker's General Store, and then also pushing west towards Camp 18. And that would hit the majority of the rest of our kids. This plan doesn't hit all of our families. We have some that are just, you know, it's kind of economy of scale. Is one tower to pick up one family, is that appropriate? You know, that's a tough call. So these three phases hit the majority of our families. So the cost breakdown by phase, you can see in front of you a total package of 1.88 million. We're pretty convinced there's a contingency built into this. We're pretty convinced with some lessons learned in Tillamook that we can shave some dollars off of this, but this is definitely the high end of what would be needed. So if we're going to do this, what we need is an agreement between Jewel School District and the county. In talking to Don and Jim and others, I'm making an ask that Clatsop County for the first phase contributes 500,000. Jewel School will contribute 200,000 to get phase 1 off its feet and up and running. Phase 2 and 3, I think those are absolutely to be determined as to how successful phase 1 is. I don't think anybody should really sign on any kind of dotted line until we see success and we see that we can replicate it. I feel very confident that we can because of the work that was done in Tillamook County. But, you know, phase 2 and 3 need to be dependent on phase 1. As promised, that is my presentation. It is short, it's to the point, and I'd be happy to entertain any questions if you might have them.
Thank you, Superintendent Phillips. I see we have a question. Commissioner Thompson.
Well, before I ask any questions, I have to do an attaboy. Hooray, hooray, hooray. I mean, all of these meetings, all of these years, you actually have done the work to sketch it out, to have the provider who can actually deliver. Tillamook Lightwave has the services they need for their community. What you're talking about is absolutely essential for your students. I love that you've taken the leadership position, but everybody who travels along Highway 26 also needs what you're offering. So there's a wider community that will be served. For that reason, I mean, I love Jewel, Fishhawk Lake, all the way, all over the heart of Clatsop County. So I'm absolutely for this. There's no question in this. Sorry, Mr. Chair. Thank you.
Thank you, Commissioner Thompson. Any other comments, questions? I see Commissioner Webb.
I'm sorry, I have a very vocal dog, and so I have to mute when I'm not talking. I have a couple of questions. The way you mentioned, did I think I heard you say fiber optic? That you were, so is this a combination of laying cables and also doing via the air?
So we get the 1 gig as fiber that comes to us, And so at the school, and then, so we have our own dedicated line already, and we've gotten permission from CenturyLink to get another dedicated line for this program. And so, it is fiber, but it wouldn't be fiber after us. It would then be towers.
Okay. Okay. Another question is, will it be possible for non-student families to buy into this system?
Absolutely. I frankly wouldn't, I hate to say this as a superintendent, but I wouldn't have it any other way. I don't even know if I'd want to go through all this heartache if it wasn't for the general community. I want to attract families that are happy telecommuting to work and bring new blood out to Jewel and work for Intel or whatever it might be. I think that would be wonderful.
Mhm. Okay. So do you have any estimates about cost? Will each of the school families, will they be paying into the system?
Yeah, if we follow, and we haven't refined it perfectly, but if we follow the model at Tillamook County, it's $65 a home. $65 per, $65 a site per home.
Per month, per year, per
month, sorry, per month.
Okay.
And most of our community out here is paying between 80 and 120. And so actually a better deal, and I can guarantee you it will be better internet than they're getting now. And the reason why we can get it as cheap as that is because frankly the infrastructure they're not having to pay for. We are. And so they can pass those savings on to the community.
So if I can just weigh in. Thank you, Chair Coelho, members of the board. Just want to reinforce what Superintendent Phillips just said, is that really the public contributions, which are the ARPA monies, would be offsetting the infrastructure costs that would normally be amortized and then charged as part of the rate structure. So this will be much more affordable and much higher quality than they would have otherwise had. The good thing from my perspective is that it's the school district that will be owning the actual infrastructure, the actual assets, the towers, and then that, according to our conversations, that gives us a venue that if we want to hang some other public facing infrastructure on these towers, we can, because as you know, there are some dead spots throughout the county regarding 911 first responder communications. And so we've talked about being able to really utilize some of these towers for some other public purposes also.
Absolutely. Thank you for bringing that up. I failed to mention that. I have a board member who's the LT Vine Maple Fire Chief. I have a board member who's married to the Miss Birkenfeld Fire Chief. We look forward to partnering with them and letting them use these towers in any way. The county road crew, sheriff's department, our own buses for repeaters. I want to use them up. I think they need to be taken advantage of.
Any other questions for Superintendent Phillips? Yes, Commissioner Webb.
I have a couple more questions. I'm sorry. Is there any kind of a formula about what it takes to using a combination? Although it actually, if we're using mostly towers, okay, is there any kind of a formula about infrastructure costs per household? Do you understand? I'm not clear.
I think I know what you're asking, but that is beyond my expertise, which is limited. I don't know that.
Okay. Okay.
I mean, I guess it depends on how many customers there are.
Right.
Fish Lake is quite concentrated and with houses. And so if 75% of those houses were all of a sudden using our towers, that's entirely different than one of the other towers that might just have a few customers. It's economy of scale, I suppose.
Oh, okay. So it's difficult then to actually come up with a formula per household. I can understand that. Yeah. Okay.
And if Chair Quayle, members of the board, if I can just add on too, is that I think that, part of the reason why some of these very rural areas don't have internet access is because of the infrastructure cost per household is so high that really private companies without subsidies are not going to put the infrastructure in. Right. This infrastructure is a lot more affordable than it would be if we were pulling actual fiber. And so, this may not be, the 20-year solution, but what we were looking for is what is the here and now solution that's actually, a 10-year, hopefully, window. And it could be longer than that because technology changes all the time. But and so that's why, we think that this is the answer if the problem statement is how do you provide suitable internet access for children, families in this rural area. So.
Well, I just appreciate the presentation, Superintendent Phillips, very much. Obviously, this will be coming back to us, and we do have another item on the agenda that we need to move on to, which is the American Rescue Plan Act monies, page 4, 30 minutes. And thank you very much, Superintendent Phillips.
Thank you very much. I appreciate your time.
I'll turn it over to our county manager.
All right, Chair Quayle, members of the board, I'll be pretty quick. And why I'm going to say that I'm going to be quick is that we will revisit this at an upcoming meeting where we can spend some more time on it. So what I will be suggesting is that I'm going to run through it a little bit and then we'll reschedule it for another meeting because I don't want you to feel rushed as we go through this. So I'll start just with a little preface about how we got here. This is $7.8 million that is coming from the federal government. The 3 areas that are focused through the legislation are really economic, social, and infrastructure impacts of the pandemic. So there's a pandemic correlation. It's public health resiliency, so allowing us to make investments in our public health infrastructure that allows us to be ready, prepared, and more resilient for whatever's coming next. And then to focus on some of the infrastructure needs, which include broadband, water, sewer infrastructure. And so what we have done, and this is the second presentation of what I would characterize as a very malleable concept. So it's not a firm concept, and I don't think that it ever will be. So as I look at this, I'm looking at it through the eyes of flexibility because it's a 3.5-year period that we'll be expending money. And I honestly have no crystal ball anymore about what's going to happen in the next 3.5 years. And so we have focused on those things that were in the legislation, but we also laid the additional filters of the county strategic plan and then the governor's economic plan, trying to figure out ways that we can leverage all these different intentions and goals into something that the board and the community can feel good about. We do take transparency very seriously, and so as your board expends these monies, this concept plan will be operationalized, and every discrete expenditure that's more than de minimis will be coming to your board for consideration. And part of that will be for us, meaning staff, to really articulate what the results are. What are the outcomes that the funding is really focused on? And that's not what this document is. So this document is just an outline. The outline will be filled as we go through these. And I'm just going to use childcare as one example. Childcare is a work in progress. There's $500,000 that has been set aside in this concept plan, but we're not sure at this point when, how, or what it would be spent on. And so as we work through those details, we'd obviously come back to the board, explain what the opportunities for funding are, explain what the deliverables are, how it fits into providing more healthcare, more affordable healthcare, more quality healthcare, and then have that conversation. So, and you could say the same thing about a number of these items. We've had a number of submittals from some of our nonprofit partners regarding some of the nonprofit set-asides. You know, we haven't brought those back to your board yet because we want you to feel comfortable with the concept first, and then individual requests will be coming back to your board as we work through this. So since this is the second one, since we presented it the first time, we've done an extensive public outreach to our partners, stakeholders, through CHART and Consejo Hispano to different parts of the community. Got a lot of positive feedback that was actually driving changes in our proposed document, which is why childcare received some additional resources. We increased the resources set aside for mental health crisis response because that was a priority for a lot of our partners. There's a new proposal that was to provide some additional mental health services in the jail because that is important to the sheriff. There's a proposal to address rural health care initiatives, increase the affordable housing grants because there's a number of affordable housing projects that are going to be in the pipeline here, and having some of those flexible pre-development grants will be really helpful to get these projects off of the ground. And then there's those other more infrastructure investments for a biodigester feasibility study, as well as participating in two projects that AOC has been working on. One is the water study, and the second is affordable housing. And we've spoken to them about participating in both, and they're both $25,000. I think the housing one for us might be a little bit more because we might be asking for a little bit more. But you know, the whole goal is to make this relevant as much as possible to the needs of the community, as well as to the strategic goals of the board, as well as obviously the legislation. So that is it in a nutshell. There's a lot of numbers and not a lot of programmatic details, and it's not because we don't think those are important, as I stated, it's just because we're not there yet. So what I'm really asking the board to do is to give the approval of the concept, and then we will bring individual funding strategies to you that have more deliverables and more outcomes. So given the time, I'll wrap that up, and I will reschedule a further discussion at a future board meeting, but if there's any questions, I'm happy to answer them.
Any questions for our county manager? Commissioner Thompson.
Only a comment. I'm for this in concept. I trust you on the details. We've talked about this basically since the moment you walked in the door. This just gives us the resources and how to move them forward into community results. I'm for it.
Thank you, Commissioner. One thing that I would say on the heels of Superintendent Phillips' presentation is one of the items that will be coming discreetly to you will be his ask for some funding for phase 1 of the broadband project. So I mean, that's just one example where we will bring that to you and we will provide a substantial staff report that will detail what the deliverables are, who will be served, at what cost, just so the board knows. And as Superintendent Phillips stated, phase 2 and 3, as much as they are detailed and they're on the table, we want to make sure that the service and the quality of that service is delivered in phase 1 before we move forward. And then the funding proportions may change as we go into phase 2 and 3, meaning there might be more cost sharing from the school district. So.
Commissioner Bangs has a question.
As we move forward with this, and as we, listen and hear to more proposals or more asks, can we kind of keep a running visual for all of us of where our starting point is, how everything is changing at each step that we take? I'm just a very visual person, and I like Excel documents.
So yes, Commissioner, I mean, one of the things we will be developing is a dashboard so that as we actually start coming to you with some of these spending plans for your consideration, those will go into the dashboard as well as the actual funding set aside and then the expenditures as they happen so that folks can actually track it and actually see what the deliverables are intended as we go through this.
I appreciate that, because I would really be sad if we got to the end of this and we were running out of funding for some, community social services that are extremely important. So I like it. Thank you.
I thought Commissioner Banks was going to suggest a big thermometer. Commissioner Webb.
Do we have to go through any kind of a federal or state approval process as we move forward?
It's not Commissioner Webb, it's not an approval process per se, but we do have reporting requirements. And so we do report back to the federal government about how we are expending it. And of course, we have to expend it within those constraints laid out.
Right.
And that's why we obsess with the actual legislation as much as we do the projects to make sure we don't find ourselves at a crossroad.
Yeah, that's what scares me a little bit.
And there's what I would say, commissioners, we're getting a lot of guidance from both AOC, NACO, and a lot of other organizations that we participate with. And so, every county in the country is in the same place, and all the cities that also received ARPA.
So, are school districts getting any kind of a direct ARPA money?
They did receive money also, but it wasn't in the same funding stream as the ones that the cities and the counties got.
Okay. Thank you.
Any other questions for our county manager? I see we're right up against the hour here. Do we want to take a minute? Okay, we'll take a couple of minutes. Thank you very much. Appreciate the process and the transparency and the outreach on this, Don. And we'll come back and take a look at it again soon.
Thank you.
See everybody in 2 minutes. All right, looks like we're all back. We'll go ahead and get the regular meeting started. The Board of Commissioners, as the governing body of Clatsop County, all county service districts for which this body so acts, is now meeting in regular session. Teresa, can we have the roll call?
Chair Quila,
Here.
Vice Chair Thompson,
I'm here.
Commissioner Toyoka, do we know?
I know Commissioner Toyoka contacted me. He's at a conference and he's not able to be here.
Okay. Commissioner Webb,
Here.
Commissioner Banks,
Here.
All right, is there a motion to approve the agenda?
Mr. Chair, Commissioner Thompson moves to approve the agenda.
I second.
Second.
Moved and seconded to approve the agenda. All those in favor signify with an aye.
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 All those opposed? Okay, motion carries. We've got 2 proclamations. Just one second here. The first proclamation is for National Preparedness Month. And Tiffany Brown, our emergency manager, is here. I'll turn it over to Tiffany.
Ooh.
Thank you, Chair Quila. Good evening, commissioners. September is National Preparedness Month, and I just wanted to make a few remarks in advance. As many of you know, Preparedness Month was started after the tragic events that occurred on 9/11. We're coming up on that 20th anniversary this week, and every year we strive to encourage our citizens, our partners, and all of our stakeholders to do something just to move themselves a little further down the curve of getting involved. Admittedly, emergency management is really tied up in the COVID response right now, so we have front-loaded some resources for our community. We have our Facebook page loaded up this month with outreach resources from FEMA and other partners in preparedness. We also recently updated some of our web pages with the new web design and enhanced some of those features. We always stand ready to assist the partners in our community. We have an outreach library, and we ourselves this ready are kicking off for the big national level exercise next June, Cascadia Rising 2022, which is the quintessential preparedness event that we all participate in together. So with that, unless you have any questions, thank you for taking the time to read the proclamation tonight.
Any questions for our emergency manager? Do we have a motion?
Mr. Chair, I would move to approve the resolution and order proclaiming September 2021 to be National Preparedness Month and authorize the chair to sign and then read the proclamation.
Second.
Moved and seconded to approve the resolution and order proclaiming September 2021 to be National Preparedness Month and authorize the chair to sign, then read the proclamation. All those in favor signify with an aye.
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 All those opposed? Okay, motion carries, and I'll go ahead. I'll go ahead and read the proclamation. Whereas the Federal Emergency Management Agency announced the 2021 National Preparedness Month theme, Prepare to Protect. Preparing for disasters is protecting everyone you love, which creates an opportunity for Clatsop County residents to join citizens across the United States in preparing for any type of emergency. And whereas the best way to improve community recovery from disasters is for individuals to proactively take responsibility for preparing their families and communities, as this significantly increases the chance of survival and return to normalcy following a disaster. And whereas Clatsop County Emergency Management partners with federal, state, local, tribal, territorial, private, and volunteer agencies to educate individuals on local hazards, how to prepare for them. And whereas Clatsop County Emergency Management encourages individuals to take action through its public education campaign and volunteer programs such as Community Emergency Response Team, or CERT, and Auxiliary Communication Service, AUXCOM. And whereas all residents of Clatsop County are urged to plan ahead for disasters and encourage family and friends to also do so by registering their contact information in the Clatsop Alerts notification system at www.co-clatsop.us/em/page/Clatsop Alerts and visiting the county's website for preparedness information. Now, therefore, be it resolved that the Clatsop County Board of Commissioners hereby proclaims September 2021 to be National Preparedness Month in Clatsop County and encourages the community to observe this September 2021, dated this 8th day of September 2021. And I will go ahead and sign that as the chair of the county board. Thank you, Tiffany. Next item is a proclamation, World Suicide Prevention Day.
Yes, we have Shira Marilla with Clatsop Behavioral Healthcare on the line.
Okay, thank you. Shira? I see Shira is on. Shira, are you able to join us? I see that she's on, but I can't.
Yeah, looks like she came back in.
Okay.
I had to jump off. This is Shira. Are you asking about me?
Yes, you're there.
Okay.
Okay.
Sorry. My speakers on my desktop aren't working, so I had to switch to my laptop, and I couldn't hear anything that was being said. So I don't know where we're at.
Okay, we're actually at the World Suicide Prevention Day proclamation, so I'm turning it over to you.
Okay, I will read the summary. So sorry about that.
No worries.
According to the World Health Organization, nearly 3,000 people on average commit suicide daily. For every person who completes a suicide, 20 or more may attempt to end their lives. About 1 million people die by suicide each year. Suicide is a major preventable cause of premature death, which is influenced by psychosocial, cultural, and environmental risk factors that can be prevented through worldwide responses that address these main risk factors. There is strong evidence indicating that adequate prevention can reduce suicide rates. World Suicide Prevention Day, which first started in 2003, is annually held on September 10th each year as an International Association for Suicide Prevention Initiative. World Suicide Prevention Day aims to raise awareness that suicide is preventable, improve education about suicide, spread information about suicide awareness, and decrease stigmatization regarding suicide.
Thank you very much, Shira. Do we have a motion from the members of the board?
Mr. Chair, I would move that we approve the resolution and order proclaiming September 10th, 2021 to be World Suicide Prevention Day and authorize the chair to sign, then read the proclamation.
Second.
Moved and seconded to approve the resolution and order proclaiming September 10th, 2021 to be World Suicide Prevention Day and authorize the chair to sign, then read the proclamation. All those in favor signify with an aye.
Aye.
All those opposed? Okay, motion carries. I'll read the proclamation. Whereas an estimated 703,000 die by suicide worldwide each year, and whereas the global suicide rate is over twice as high among men than women, and whereas suicide rates are high amongst vulnerable groups who experience discrimination, such as refugees and migrants, indigenous peoples, lesbian, gay, bisexual, transgender, intersex persons, and prisoners. And whereas in a national study, 40% of transgender adults reported having made a suicide attempt, 92% of these individuals reported having attempted suicide before the age of 25. And whereas rates of suicide deaths among individuals experiencing homelessness are 9 times higher than the general population, and whereas veterans aged 18 to 34 are at the highest risk of suicide in Oregon and are more vulnerable the more recently they have been discharged from service. And whereas in 2019, there were 116 reported youth suicide deaths in Oregon, making suicide the second leading cause of death for people ages 10 to 24 in the state. And whereas according to the Oregon Health Authority's preliminary data in 2020, 828 Oregonians, 7 of which were Clatsop County residents, died by suicide, with each death leaving behind a grieving community of family and friends. And whereas many of those people who died never received effective behavioral health services for many reasons, including the stigma of using behavioral health treatment and the stigma associated with losing a loved one to suicide. And whereas suicide is preventable, and now therefore be it hereby resolved that the Board of County Commissioners of Clatsop County does hereby proclaim September 10th, 2021 as World Suicide Prevention Day. In Clatsop, sorry, I didn't finish it. In Clatsop County, and invites all community members to join in this day of observance by raising awareness, reducing stigma around suicide, and encouraging well-informed action. Dated this 8th day of September 2021, and signed by Marquila, Chair of the Board of Commissioners. Next is business from the public. This is an opportunity for anyone to give a 2-minute presentation about any item on the agenda, except public hearings, or any topic of county concern that is not on the agenda. Clerk of the board, are there any members of the public who have registered to speak?
No, there are not.
We'll move on to the consent calendar.
Mr. Chair, move adoption of the consent calendar.
Second.
Moved and seconded to move for adoption of the consent calendar. All those in favor signify with an aye.
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 All those opposed? Okay, motion carries. We'll start with Commissioner Liaison Reports. Commissioner Thompson.
Thank you, Mr. Chair. I have nearly completed my aging in place backup plan for when I am unable to perform as a Clatsop County Commissioner. I hope that is many years in the future. It's a formidable endeavor, and I appreciate the support and accommodation that my colleagues and family and friends have made to help me in that effort. Notwithstanding all that, still working on housing issues, affordable housing issues. I just spoke this evening with the Bishop of the Episcopal Diocese of Oregon, who remains our committed partner in this regard. I am over the moon about broadband in Elsie Vine Maple. I mean, when you think of all of the years and all of the meetings and all of the superintendents and all of the county managers and all of the everybody who has been involved in this, it's really a considerable accomplishment. I am particularly grateful to Mr. Boone, our current county manager, for his successful efforts in bringing this to consummation. Way to go. Way to go. And for Superintendent Phillips to step up and be the community leader in this, just really an opportunity for economic development and redevelopment in Elsie, Vine Maple, and that whole heart of Clatsop County area. It's just, I think this can be a pivotal moment in our collective history, because we know that just because we get a house for somebody, if they don't have a job to give financial support to their families and their communities, if they don't have that source of identity and satisfaction and competence that a real sustainable career can bring to somebody, we haven't done our job as commissioners. And I'm grateful to work with you, my colleagues, as we collaborate to make this possible all over Clatsop County and beyond. So I want to say that. I also want to say that the AOC District 7 meeting will be held. Wait, let me check my calendar. We're going to have it on the 20th of September. Commissioner Webb, I gave you the wrong day earlier. It's the 20th of September from 10 until 2. They had to do a pivot because now it's a virtual meeting. This COVID and its variations is such a formidable challenge to all of us. I really understand that some people have a reluctance to put a vaccine in their body for some reason. I have a much more challenging time seeing why somebody would object to putting something on their body when I look at the sickness, the death, and the long-term negative results with the greatest affection and respect for everybody's opinion, no matter what it is. I'm very cautious. I am holding myself and those I hold dear in safety by urging them to do what they need to do to protect themselves and others from this terrible illness. Thank you, Mr. Chair.
Thank you, Commissioner Thompson. Commissioner Bangs?
Just a couple things. There was a CFTLC meeting recently and then an ODF meeting today. Things continue to progress with the HCP and the FMP. And then there is a climate change, I think they're calling it a CCCP. So many acronyms. I feel like I need a dictionary for it all. But things are progressing. There was a public statement made by FTLAC today during the ODF meeting. I can share that with you if you request. Otherwise, you can visit the ODF website and preview their meeting link that occurred today. I was pleased on a different topic to be able to officially endorse the Yes Napa community group in their efforts for our Napa school bond. I feel like as all of these other school districts are able to upgrade and get their new things and be able to make a safe environment for their children, I was happy to help them out with a grant, but then also just to be frank, no matter what we look at in the past or what has occurred in any school district in the past, what we always have to look at is the present. And our present is our kids need a safe environment. They need ADA compliance. They need work on their heating system, work on their electricity. They need all kinds of things, and they need actual space. Our community is growing. And so I was grateful to be able to jump on and officially endorse that process. And then lastly, I took this last week and spent time with my family. School started this week. I am returning to full-time teaching. I had forgotten how exhausting that is. But yeah, as we move forward, school is in session and I am seeing kids actually in person all day long, and it is amazing. It is amazing. I have missed these kids. So anyhow, that's all for now.
Thank you, Commissioner Thompson. Commissioner Webb?
Attention world. I have good news for you from the Northwest Oregon Housing Authority. Yay! 2 huge milestones were achieved just in the past couple of weeks. We are in negotiations for a person we are very excited about with a very diverse and exciting background to accept the position of executive director. We're negotiating the little things, and so hallelujah. The other thing, which has been, for those of you maybe who weren't here a year ago, HUD came in and gave an audit to our HUD-funded programs. And basically, Noah flunked the test. But the good news is that HUD and a consultant who we have hired have worked vigorously with us to solve the problems that the audit found. And everybody has worked so hard on this. And we submitted, at the beginning of this month, we submitted a revised plan for the disposition of HUD funding. And HUD in Portland gave it a quick, okay, good job, guys. So we're hoping that in a month or so, we will be out of the woods, that we will be out of the troubled category that they designate housing authorities to be in. I cannot tell you how much work the NOAA board has put into this. We meet usually 2 or 3 times a week for various, and it's everything. This is such a complicated entity that, for instance, I don't know if I've mentioned this before, but NOAA had 82 different bank accounts. That sounds to me like the mafia or some kind of RICO problem. But it's their funding streams are so diverse that it's just very difficult, the money management part of this. And a third thing is that the housing development with 42 units of family-sized apartments has received the okay from all of our funders. That's in the heart of Commissioner Cuela's district. It's a very exciting project. We're in a partnership with Clatsop Behavioral Health, who will actually have space inside this building. We've got our funding in order, and we're about to sign on the land. And so I can't tell you how good this feels for all of our good. 42 units of single 2-bedroom, and I think we even have a 3-bedroom and a 4-bedroom unit, just desperately needed, as we all know. It's a great location. It rings all the bells. It checks all the boxes. So that's my good news. And last 2 weekends, I spent in Portland with my 1-year-old granddaughter for her birthday, and over Labor Day for just a family hugging fest. So, last week was kind of good, but I kept feeling like it was maybe the 5th week of the month, because everything lightened up. I mean, did it? All of you feel that? It was like, oh my God, I had days that I didn't have any commission work to do. What? So anyway, so I'm rested and crazy as ever, and it's nice to be back looking out over the Columbia River.
Thank you, Commissioner Webb. Every month should be August.
Yes.
No, appreciate the update. Great news, and thanks again for the report. To Commissioner Bangs had mentioned about school starting. My daughter's starting school tomorrow for the first time, and we're certainly overprotective parents. We want her to be in a safe environment when she goes to school. I heard the public health director's kind of report on the vaccine being available, hopefully for my daughter in November, and then for my youngest in January next year. That's exciting news, and certainly we anticipate that being a real relief to our family. And I can't help but say, we've lost some members of our community over the last couple of weeks, people that are well known, people that have a lot of family and friends. And I I hope that this is kind of a wake-up call to folks that that this is real, and that maybe they need to get vaccinated, because we're losing too many people. So it just is a real sad, and it kind of breaks my heart to hear about the folks that are fighting this virus and that have actually passed away. Anyway, I will move on to the county manager's report. Don.
Chair Quayla, members of the board, if I could just kind of comment about what Commissioner Quayla was just saying. I think that, one thing that distinguishes, Clatsop County's employees, and certainly we see this with our public health staff, is that they care. And they don't care on the sidelines. I mean, they care deeply about the work that they do. And, when there is a way to prevent some of the heartache and some of the tragedy and some of the pain of this pandemic, it even makes their work harder. And I'm sure Commissioner Quayla sees that in the hospital as well. And so, passion meets challenge all the time. And this is certainly one of those cases. But the good news is that we're in it for the long haul, and we're going to continue to support the community, and that's all members of the community, as we go through this. Just a couple of things. I did want to say that I spoke to Steve Meshke today about the Westport boat ramp project, and if you're interested in seeing some of the pictures, there's a tab on the parks website, and a lot of work is going to be culminating in the next couple weeks. So, kudos to him and his staff and the contractors. It's going to be a really nice amenity for the county. The other is that, sorry.
Can I interrupt you? I'm sorry. Are we going to have a big celebratory bash?
Yeah, when we get there. Yeah, when we get there, absolutely. So, absolutely. And then, unfortunately, workload is going to amp up for Commissioner Webb and for everybody else now that we're in September. And part of that is, we'll be coming and talking to your board about the strategic plan, the next iteration of the plan, which includes us updating you on the progress that we've made on the projects, and then have some conversations about some additions that you might want to add so that we can focus on it for next year. So that'll be coming up. We obviously, the comprehensive plan is still a major project for our community development team. And then we have all these capital projects like the jail, and that's going really well, but there's a lot of work and a lot of energy that's going into that. Tomorrow morning, we're having an all staff meeting for the county. Give me an opportunity to talk a little bit about COVID, what's going on in the organization, answer questions. Margot, a public health director, will be giving information about the COVID response and the most updated information. And Kelly Stiles will be talking about some of the policy changes that we've been making as COVID continually evolves. So it's always a good opportunity for us to touch base with our staff. And, honestly, it's been hard during COVID. I mean, so virtual staff meetings are never as good as the real thing. So, but we persevere. And then I just wanted to say that I will be out of the office on between the 14th and the 20th. I'll be taking my youngest son off to college and then consoling my wife thereafter. And so that'll be what I'm going to be doing. So I'll be available, but the county will be in Monica's good hands when I'm gone. So that's all for my report.
Thank you, County Manager. Enjoy that trip. We'll move on to the business agenda. We have one item, and that's the architect and engineer on-call contracts on page 98. And County Manager?
Actually,
Monica Steele will be presenting on this.
It's actually Dave Diefenbach, our capital projects manager, but
Sorry about that.
That's okay. I'm not sure.
Dave is there. He's here.
Yep. Can you hear me?
Can hear you.
Yeah, okay. So welcome this evening, commissioners. And this is an on-call contract for architects, which is unusual for us. The first time we've done it with architects, we've done it for years with like tradesmen, you know, for electricians and plumbers and everything. But we felt the need to do this to allow us to especially do preliminary work on some projects or some smaller projects. And so we, you know, issued an RFP, and surprisingly, we had 11 people, you know, firms turn in proposals, which is unusual because we've had times when we've had one architect turn in a proposal. And so we have narrowed it down to 3 architectural firms that were reviewed and we felt were the best and scored the highest. And we're requesting approval of those 3 on-call contracts. And if you have any questions, I would be happy to try to answer them.
Any questions for Dave? I see Commissioner Webb.
Yeah, Dave, my only question is that when it comes time to selecting these firms, how do you choose among the 3? Is it because of special expertise that they have, or?
Yeah, I think that's, you know, we have not started one yet, but that is, you know, some of them are more specialized in like historic and courthouse work, and some of them are more technical, you know, they've done, you know, water treatment plants or something like that, you know. And so I think it's going to be, probably is going to be similar to our on-call with, like, say, a plumber. We get one that's kind of specialized that works in the jail, so we kind of call that one all the time to work in the jail. But it's not, you know, that we'll try to divide it up, you know, so we don't have all the money and time in one firm, you know.
I have gotten several calls from local architects who were disappointed that we didn't keep this award local. I am always in favor of dealing with local vendors on just about any issue, but I tried to explain to them that we have a diverse need for architects and engineers, and that you might have a transportation engineer in one firm, and you might have another firm with a civvy, and so you almost always have to go farther away into the Portland area to get that variety of expertise. So I hope I answered that correctly. I was trying to prevent people from calling you, Dave.
If I could,
people call me all the time, but that's a good explanation to them.
Chair Quilla, Commissioner Webb, board members, if I could real quick, I think that we're certainly sensitive as well as we've pushed through on the jail project of using as many, you know, local contractors as we can. To your point, Commissioner Webb, there are unique architectural demands, especially with the age of some of our facilities and the historical nature of them, that you become really specialized in some of these areas, and not every architectural firm has the depth and the breadth of the experience that is needed. And so certainly that's something we will always consider, but in this case with architectural services, as you said, and I think you said well, there's a lot of different factors that are going into these decisions.
Any other questions? If not, we need a motion.
Mr. Chair, move to authorize the county manager to sign the contracts with De Loretto Architecture, LLC, Sarah Design and Architecture, Inc., and Scott Edwards Architecture to provide on-call architecture services for a period of 5 years, and to authorize the county manager to sign amendments up to the $100,000 per contract.
I second that motion.
Can I press pause really fast and ask a question?
Just 1 second. So it's moved and seconded. to pass the amendment. Is there any further discussion? Commissioner Banks.
I see Joanna on the line and I need to ask her a question.
I'm here.
Should I recuse myself from this vote because I just noticed on the list that I have a family member that works for one of the subcontractors?
I think to be on the safe side, you declaring it, it would probably be best if you did.
Okay, I'm declaring it and I'll be.
Thank you.
Okay, and that's sufficient. Okay. Okay, moved and seconded to authorize the county manager to sign the contracts with D. Loretto Architecture, LLC, Sarah Design and Architecture, Inc., and Scott Edwards Architecture to provide on-call architecture services for a period of 5 years, and to authorize the county manager to sign amendments up to $100,000 per contract. All those in favor signify with an aye.
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 All those opposed? Okay, motion carries. Did everybody vote?
With one abstention.
One abstention. Okay. Thank you, Dave. Appreciate it.
Thank you. Thank you very much.
Do we have any items for the good of the order? Commissioner Thompson.
You know, I just love it that a commissioner asked about a conflict of interest and recused herself. I just think that's swell. Good job. Thank you. I think that's for the good of the order.
That's great. Thank you, Commissioner Thompson. Good job, Commissioner Bangs. Any other items for the good of the order? All right, if not, we'll go ahead and adjourn this meeting. Thank you so much, everyone. Have a good rest of your Wednesday, good rest of your week. Talk to you soon.